Hello, and welcome to Development Reimagine's Decolonizing Development video series. My name is Osaru Omosigho, and I am the Global Health Program Manager at Development Reimagined. In this series, we seek to provide an insight into what it means to decolonize development, what results it will have, what that change will look like. How do we, in all parts of the world, whatever racial, gender, disciplinary, social, or other background, drive change? We've seen that development, health, and humanitarian organizations of various sizes are reflecting, becoming more transparent about these issues, and recognizing that they need rebalancing. But what comes next? How do we change a buzzword into real, tangible action? If you don't already know, Development Reimagined is a leading independent and African-led international development consultancy with our headquarters in China and with offices in Kenya and the UK. Our mission is to provide new ideas and solutions to deal with the complexities of global poverty and climate change, and this is a mission our diverse team really strives for every day. For this session, I'm very excited to have our distinguished guest, Dr. Romina Istratii, who will share some insights on one of the key themes of what it means to decolonize development, shifting ideas of knowledge. But first, what do we at Development Reimagine mean by the ideas of knowledge? Knowledge production refers to the formal and informal ways that knowledge is produced, whether through a school curriculum, a university, a capacity building or technical institution, or even companies and the ideas they are generating, even at the UN. Decolonizing ideas of knowledge and knowledge production requires dismantling and critiquing the colonial and ethnocentric foundations of what we think is the best type of knowledge and the best knowledge systems we have today. By looking at and deconstructing whether our current knowledge systems are really universal or actually derived from certain parts of the world, decolonization helps to open up, construct and endorse other types of knowledge and knowledge systems. Dr. Romina Istratii is the perfect person to help us do that. She is a UKRI Future Leaders Fellow at the School of History, Religions and Philosophies at SOAS University of London. She was principal investigator of the UKRI funded project Bridging Religious Studies, Gender and Development and Public Health to Address Domestic Violence, a novel approach for Ethiopia and the UK, and the creator of Project Dodo. She is the author of the monograph Adapting Gender and Development to Local Religious Contexts, a decolonial approach to domestic violence in Ethiopia, published in Routledge 2020. She is a critical international development thinker and practitioner from Eastern Europe, with decades-long experience in developing people-centered approaches for analyzing and addressing issues with gender dimensions in African religious societies. In 2019, she initialized the Decolonizing Research Initiative under the aegis of the SOAS Research Directorate, and in 2020, she co-founded Decolonial Subversions, an open-access, multilingual, peer-reviewed publishing platform that aims to promote the diversification of knowledge production. That means Dr. Romina is the perfect person to help us understand how to shift ideas of knowledge in development and why it really matters to our practice. Dr. Romina, thank you very much for taking the time to have this discussion with me today.
Thank you for inviting me.
So without further ado, I would like to kickstart this interview with our first question. Can you give any practical examples that have worked to diversify ideas of knowledge and ways of generating knowledge? What made them successful and important?
In thinking about this question, I've identified 3 examples that I can give. One project that I have read about quite a bit, one project that I have researched on, and one project that I have developed and I'm implementing currently. The first project that I have read about, I don't have direct experience with, is SASA, a model of mobilizing communities to prevent domestic violence in Eastern Southern Africa, which you might be familiar with. As I understand it, SASA is really a methodology and an approach designed by an Uganda-based non-governmental organization known as Raising Voices, and works with women, children, the community, men to address those gender asymmetries in power relations and relate that to domestic violence and HIV/AIDS. From what I understand about SASA, I'd say in my interpretation it's been successful because it's grounded locally, it understands people's lived realities, it understands what terminology might work with the community, how to engage with the community in order for the community to be to resonate with the initiative and its approach. So, for instance, on the website of Raising Voices, it is said, quote, "Witnessing the challenges and in some cases backlash in using gender and rights in programming, SASA reframed violence prevention by using the language of power." Close quote. And what this sentence tells us, and tells me at least, is that the programmers have been very reflective about the limitations of the project, of the approach, and have aimed to adapt to its challenges and its limitations. Instead of persisting in using a certain terminology, whether it is the human rights language that is used in international development, or a feminist gender rights that is used in gender and development, they have tried to adapt to a terminology that works with the community and that community resonates with. The second project that I wanted to refer to, that I have researched on in person, is the IPMS project in Ethiopia for gender-sensitive agricultural development. The IPMS project stands for Improving the Productivity and Market Success of Ethiopian Farmers. It's a pilot project that was initialized in Ethiopia in 2004 and was officially completed in 2009, and aimed to reduce rural food insecurity in the country through market-oriented agricultural development for both men and women. And the project was initiated by ILRI, the International Livestock Research Institute, under the aegis of the Ethiopian Ministry of Agriculture. So it's very much locally grounded, with financial assistance, obviously, of a donor, in this case, the Canadian International Development Agency. Now, in researching IPS and why it was successful, and in fact, I spent a year in 4 African countries at the time and more than 60 communities to review different gender-sensitive programs. And this one stood out because what the programmers did actually, first, they understood that the needs and opportunities for men and women differ by context in Ethiopia. Ethiopia is a very diverse, culturally, commodity-wise, site-wise country. And so they did not assume or theorize a priori, the nature of gender differentials, but they actually did extensive research to record the characteristics and the dynamics, the gender dynamics within the family, within agricultural work, within the farm. They collected extensive data, and then they adopted to that data and what the data showed. And instead of alienating the men, again, who oftentimes tend to be the main decision makers and recipients of agricultural development training, they actually incorporated approaches that worked in a way that did not alienate the men, again, given the patriarchal system within which they work. So they adopted, for example, couple trainings, which were quite successful. The third project and final one that I'd like to refer to is a project that I created and designed and I currently lead. This is called Project Dildil. Dildil in Tigrinya language means bridge. Dildil is a UKRI funded research and innovation project. So funded by the UK Research and Innovation, which is the umbrella organization of the research councils here in the UK. And is dedicated to developing and strengthening religio-cultural sensitive approaches to domestic violence in Ethiopia and in the UK. Now, the project responds primarily to the hierarchical dynamics and the epistemological dominance of Western societies in international development theory, but especially in gender and development practice, that inform domestic violence responses internationally, and aims to implement a more reflexive, decolonial and locally grounded model to reverse these hierarchies, not only in knowledge production around the theory of domestic violence and appropriate responses to it, but also to promote a response to respond to the problem that works through indigenous knowledge, through local stakeholders, and through multiple theoretical frameworks to respond to this complex problem. Most importantly, the project aims to reverse the knowledge transfer that has historically been from the West to the rest, by having actually evidence produced and good practices identified in Ethiopia inform approaches in the domestic violence sector in the UK that is called to cater ethnically and religiously diverse communities here in the country.
That was very insightful. I find it really important how the context was included for all these projects and how they focus on how things work on the ground and involving the community. Not just, for instance, using or superimposing experience of overcoming domestic violence that might have been used in the UK or the US. But how did you do this exactly? I mean, you are the lead, you're a white woman. Was this not difficult to swoop in and leave?
We work through ultimately a decentralized partnership model whereby different aspects of the project are co-produced intentionally with different locally grounded partners. All Ethiopian partners who specialize in different aspects of the project, whether it is research or intervention design. We're working with victims and perpetrators and so forth. And so the idea here is that not only that they have a substantive and a significant stake in the project design and in the decision making around the project design, but also there is a mechanism in place to ensure the sustainability and the continuity of the project, because these organizations, if they participate in the design of the project and have a stake and believe in it, then they can continue the implementation of the project or the model after the project ends and I depart and the project team departs.
Right. It is important to include that partnership and sustainability in any project, especially at the design stage. But what about when it comes to knowledge itself? What we capture as developments, for example, in journals? How do we dismantle global north-driven research and authorship?
Well, that's a very important question, a very difficult one, and I would say not an easy answer. But I think the approach is ultimately a combination of personal commitment to do so and structural change. And these structural changes, from what I've learned in my own experience as a decolonial activist, researcher, but also as a professional research development staff here at SOAS, is that the structural changes don't have to be massive or radical necessarily, but small reconfigurations that can ultimately foster a systemic change. But these reconfigurations have to be done with an intentional decolonial reflexive perspective. Otherwise, just changing things will not necessarily address the actual problems. So what do I mean by that? It all starts, I would say, first and foremost, with the structures of funding. So I mentioned briefly, I've worked as a research funding officer here at SOAS. One of the reasons that I wanted to work as a research funding officer is because I wanted to understand the connection better between the dominance of Western societies in knowledge production and the inequalities within the funding landscape. So on the basis of that experience, I understand that most funding is based in the global north, and that means that funding rules tend to be favorable to researchers affiliated with these countries. For example, much UK funding requires that the principal investigator, the lead, be based at a UK institution. Now calls are starting to diversify, and some calls allow principal investigators to be based in countries of the wider global south, or what we call low and middle income countries. But these tend to be these calls tend to be of a certain nature. So it's either networking, knowledge exchange, capacity building workshops, which tend to again be defined by the priorities of northern funders. When it comes to research grants, and grants such as the one that I hold, research and innovation grants, budgetary arrangements continue to be generally unequal. And this means that in general, when someone controls the budget, the objective of the research will also tend to be determined in the largest part by the northern principal investigator. Even if the principal investigator is reflexive and aims to implement an equitable approach and is intentional about it, the structure itself does not allow much flexibility oftentimes. So the first thing I'd say is for academic and research funding to become more equitably distributed in the world. So we need more Southern donors, more donors and funding bodies in the global South. They can be supported by global North donors. And the Southern donors, should actually mediate who gets funding in their context. So they should be the ones allocating and awarding the funds according to regional and local priorities, and not necessarily the priorities that are defined by Northern donors. And then most importantly, funding has to be delinked from national agendas and political priorities, because the reality is that funding, one thinks of UK funding, such as the Global Challenges Research Fund or the Newton Fund. This is funds that come actually from the country's commitment to provide aid to low and middle income countries. So it's very much linked to national priorities and strategies. And that, again, comes with a set of restrictions and conditionalities.
Do you think funders of knowledge production, the research institutions, can really change in this way?
And in my understanding is that funders are very receptive to that feedback, and they need that feedback. and they will try to make changes, because I think we live in a time where business as usual is not anymore viable. So funders know that. And the more we communicate from the ground to the funding bodies, to the decision makers, to the regulators of the research development and the international development landscape, our challenges and how unhelpful certain processes might be, the more the funders will feel the pressure for change, and the change will happen.
Okay, so what about the knowledge itself? How to make sure Northern researchers are not just using Global South partners to profit from their knowledge?
The second thing, in terms of IP, intellectual property and authorship inequalities, I'd say, again, those are linked to funding inequalities and budgetary arrangements, first and foremost, because the design of the project will determine who will author what, and how the work will be attributed, right? And how the work will be disseminated. So the first thing that I'd say, as someone who leads a very large project, which is international, with at least 9 partners in different countries, is that the rules of authorship and intellectual property should be reflected in the contract signed with the partners very early in the project design. The publication or the sharing agreements should accommodate the needs of the Southern partners, right? Writing an article or a paper that is then logged in a specialized journal might not be useful to them, right? It might not be the way in which they want to generate impact in the local society. So all these different needs in terms of outputs and how these outputs should be disseminated should be agreed collaboratively, discussed collaboratively, and then reflected in the contracts early on. Again, it's important for Northern researchers, especially, to negotiate carefully, to discuss carefully the terms of contracts, because again, I can tell you, being at SOAS, we have very long contracts, and those contracts have multiple clauses about intellectual property and authorship rights. So it's important that Northern researchers and principal investigators take the time to explain the terms very clearly to their partners and the implications of those terms, and make sure that everyone agrees and everyone is on the same page, essentially. Lastly, I'd say inequalities in authorship are also due largely to the norms of knowledge production and publishing, whereby citation norms, language use, and peer review processes remain quite West-centric. So, as you may know, much research is still locked or accessible to very specialized communities of academics, not very much connected to the public. Now we have a shift towards open access policies, but open access policies are not necessarily a panacea because they tend to be appropriated by big publishers and used as yet another exclusionary business model. I have written an extensive paper on why that is, but in essence, not everyone can afford to pay the article processing fees, either as an author. The assumption here is that it will be either a funder or your institution that will pay for those article processing fees. But in fact, internationally, authors are based in different institutions, different countries that do not have economic parity. And their institutions are not as resourceful as institutions, let's say, in the UK or the US. Principal investigators and their partners, when they co-create projects, could move towards more community-oriented and decentralized models of ownership, intellectual property ownership. For example, is there maybe a public body that could be involved in administering intellectual property and make decisions on behalf of the community about the use of that product, right? How can project outputs, models, or interventions be developed in a community-centered manner so that the community has a stake from the very initial stages of the project and is involved in all decision-making, including how IP will be used?
Agreed. Those structures could certainly help to protect diverse forms of knowledge properly. But Dr. Romina, how to ensure that what is seen as knowledge is not just Northern is best?
I would like also to draw an example from Decolonial Subversions, which is a platform and a network that I co-founded with my colleague, Monica Hirmer, and brings together colleagues from multiple African and Asian countries and the wider world. And that ultimately, through this platform, we aim to subvert Western epistemology in publishing, in particular, but also overcome barriers in access to knowledge. without charging any author, using and inviting contributions in all languages of the world in diverse formats, including text, acoustic, and visual. Again, because we understand that people know and learn and share learning in different media and ways. We also use a more transparent peer review process to overcome, lingering biases in peer review. And to ensure that reviewers are diverse and based in Southern societies and institutions as well. So there's multiple ways ultimately to overcome these norms in knowledge production and publishing, but these need to be quite creative and they will not necessarily subvert or overturn the existing system that is maintained by big publishers, but it is important to create more outlets for researchers across the world who may not have the same capacity or cultural capital or linguistic capacity to be able to publish in the mainstream. And be very reflexive about what we call data, because data is socially constructed. Is a subjective interpretation. What is the process of communicating with the community? What translations happen, both in terms, in linguistic terms, but also in cultural terms? Because obviously, oftentimes concepts need to be translated across cultures. What biases exist and what subjective interpretations are made in the process of theorizing or applying a theory cross-culturally? What do participants say and not say? Because oftentimes there is a lot of information that is communicated non-discursively, or communication is very strategic, so people will not divulge everything that they might be able to divulge. So this ultimately, these questions pertain to the need of being reflective and reflexive at all times of all the decisions that are being made in a research project, in a project design, because. And especially in community engagement, because that communication and those decisions that are being made about communication and data analysis and data interpretation will ultimately inform the output and the outcome and the findings, what we call findings. So it's important to be very humble, very self-aware of the limitations we have when we engage with real people. Ultimately, the way we are very multifaceted, multidimensional, our research participants, our communities are multifaceted and multidimensional, and they're very strategic about communication. So we need to understand our limitations. That project leads, principal investigators, whether it is a program or a research project, should speak the local languages. I think, and this is a real limitation in international development, it's just striking to me how very few people speak local languages, but yet lead international programs. And I say this not to sound judgmental. Of course, people have different capacities and different skills and talents, but it's really important to have a bridge of communication with the communities and the stakeholder groups. And language is truly important. I would say in the Ethiopian context where I work, I wouldn't be able to work without Amharic. I also speak Tigrinya, which is another region I work in, but I wouldn't be able to. I wouldn't be able to do what I'm doing without Amharic. Not only because I actually train clergy within the context of my project in Amharic, but just for communication with the partners. So I really think that language is important because it's the first step of communication. It doesn't guarantee that we understand each other, but it's a tool that we need to cultivate a bit more conscientiously, I'd say. I would also say that teams need to be diverse and collaborative. So the more collaborative the teams and the more collaborative the modus operandi, the more likely is that the outcomes, first and foremost, that people will be accountable to each other, to the project vision, to funders, to communities, to different stakeholder groups, because each person will be accountable to different groups. So the more collaborative you are in a project, the more interests you capture, right? So the more interests and the more communities and the more stakeholders you are accountable to. And finally, I'd say that there should be a mechanism within projects, whether research projects or international development projects, interventions, programs, there should be a mechanism for sharing constructive criticism and feedback, and that allows for real-time learning and adaptation. The problem with many programs that I see, including many good research projects, is that they have a very promising vision or approach, but they're not too rigid. They're too rigid in making changes. So they're not as flexible as they could be, or agile. And we live in times that we need to be very agile and very entrepreneurial because things change every day. When I started my project in Ethiopia in November 2020, 4 days later, the war in Tigray started. And obviously, a lot of my activities were planned for Tigray. And thankfully, we were able to create a project that was flexible and multidimensional and multi-stakeholder, so we could shift things around and adapt things and be flexible. But also to have a mechanism for real-time learning. I think this is truly key. Oftentimes programs wait until the end to do the learning because they need data collection, whatever the tool for assessment might be. But actually, it's more useful and a better investment of time, I'd say, to implement a mechanism or to have in place a mechanism that allows you to collect that data or feedback. Not necessarily in a formal way, even in an informal way, to learn as you go, whether it is by having regular meetings with partners involved in different aspects of your projects.
And in fact, this moves us well into my final question. Is there also an issue of how projects are praised and evaluated, how they are seen as successful or not, including in research? Can ideas of knowledge be imposed in this way too?
And I think it also depends on the definition of accountability and how we think of accountability. I think I'll repeat some points that I made, but perhaps make them more specific. I'd say that global health and aid research and programs in particular need to be more connected to communities and work through real communities and with real stakeholder groups. What I have found in my own experience is that when this connection is there, whether during the research proposal development, the project design, or its implementation, the outcome will always be more attuned to the conditions and the needs of the real stakeholders involved. So it will be also useful for the program itself. That's what I'm trying to say. If I understand that multiple programs don't have the privilege to design a project with the needs of the community in mind, only because they also have to cater to the needs of donors and funders, and they have multiple other restrictions to navigate. But actually, in fact, when one is attuned to the needs and the conditions of the community, the program can be more successful, can be more fruitful, and that can be also used to request further funding, to meet funder conditions and so on. So I think it's really a win-win situation. Moreover, the project, I would say, would need to be designed that in a way that is accountable to those it aims to serve, right? Again, linked to my previous point. However, to be connected, I really think that researchers and project teams have to make sacrifices and be willing to engage with the communities and put their sleeves up and do the work. And that might require being based locally. I lived for the past year and a half in Ethiopia. I'm based in Ethiopia. And before that, I was again based in the African region. Because I believe that one has to be locally grounded to engage with the partners, to engage with the communities, to build that trust, to build that understanding, to oversee processes, to support partners and team members as they need and when they need it.
Dr. Romina, if you could choose one word to help those who are not familiar with the idea of decolonizing global health, if you could pick one word to help them understand what decolonizing global health means, what word would that be?
Overuse this term, but I think humility, unfortunately, is misused now the way decolonization is misused. But I do believe that in essence, what we need is humility, because when one is humble in their approach with the world, one is more careful about their assumptions, more careful about their engagements, and it's I think it's a medicine to the, I would say openly, the arrogance of international development that we have seen historically. So I think at the end of the day, it's about embodying those values and the ethos. It's not going to be a list of solutions, practical or technical solutions. It's going to be about people change. And at the end of the day, it's all about people. And I cannot emphasize this enough. It's really about human connection. Everything in cross-cultural work, whether it is research or programming or development intervention, it's about human connection. And what we've lacked is the human connection, because it's been a very technocratic way, top-down, hierarchical, technocratic way of doing development.
Thank you, Dr. Romina, for joining us in this discussion. We're very grateful for your help in explaining how to deconstruct and reconfigure our development projects so that they don't fall into the trap of reinforcing certain ideas and means of knowledge production. Thank you.